Well, welcome everybody. Thank you so much for taking the time out of your schedule to join us today. We are very excited for what is the third presentation in our 2021-2022 grant webinar series. Today's presentation, as you may have heard just a moment ago, is going to be recorded for future listening. We do expect to have that recording available to you by the end of the week, and we welcome and encourage you to share this with anyone who may be interested in learning more about the topic or about learning to apply for the grant participation program later this year. Before we begin, I'm going to take a moment and introduce Corey Kilgore. Corey is the executive director of the MHCH Foundation, with whom we would not be able to offer this incredible grant opportunity. The MHCH Foundation generously funds the Global Rural Nursing Virtual Collaboration Learning Grant. And just as a reminder, applications are currently being accepted for this year's program. And we do have information about eligibility as well as the application itself directly on our website at grnen.org. So without further ado, Corey.
All right, thank you. And good morning and Godrian, or good afternoon. So I would like to just thank you guys for your time today. I know that it's difficult when semester's over to kind of come back together again. In the US, we're in the summer time frame. I know that the semesters work a bit differently in Africa, but anyway, thank you for coming back together to share your work. You guys are one of 5 recipients of the MHCH Global Rural Nursing Collaborative Learning Grant. And you are also the pioneer. So you are the very first group of universities partnering together internationally to focus on rural nursing and the role of nurses in rural communities. And so one of 5, and we have also really had the opportunity to learn from your experience from a grant making perspective, to understand how we might continue to design and tweak this grant so that it is more effective in the future as far as providing an awesome learning opportunity for both the educators, the nursing students who are involved in the grant, and then also the communities, the rural communities that could be recipients of your work in some way. So we appreciate having the opportunity to learn from you over the past year. This was the 2020-21 academic school year. And as Stacy said, the applications are now open for the 2022-23 academic year. And the upcoming year, I think our grantees are going to have actually an even longer period of time to work on their project. So it's been extended by 6 months, but we encourage everyone to apply. Historically, the MHCH Foundation has not been a grant making organization. This is our first time to do this. So we're really excited about it. And so congratulations to all of you, and thank you very much for your time.
Thank you, Corey. Now, before we get started, just a brief note on housekeeping. We will have plenty of time for questions and answers, but we will hold that to the end in order to give our presenters the opportunity to get through all of the opportunities they want to share. However, you may feel free to drop your questions in the Q&A feature on your Zoom panel or in chat at any time, so you don't forget what you might want to ask. And at the end of the presentation, we will ask that on your behalf. Now, I would like to take a moment to go ahead and introduce our wonderful presenters today. Lisa Feller is the Director of Regulatory Affairs and an Associate Professor at the University of South Dakota Department of Nursing. Lisa has over 36 years of healthcare experience and 25 years of experience in nursing education. Her areas of expertise include adult health, rural health, leadership, and quality improvement. She was a member of the Quality and Safety Education for Nurses pilot project and has provided consultation to nursing programs regarding the integration of QSEN competencies and curricula. In addition, Lisa has worked closely with community and practice partners to implement workforce development models in rural settings. Ann Pithen is the chair of nursing for the University of South Dakota Department of Nursing. Ann has over 34 years of nursing experience in nursing leadership, nursing practice, and nursing education. Ann's area of interest includes leadership development and mentoring, curriculum design, professional identity formation, and evidence-based practice. She has developed nurse residency programs, clinical ladders for nurses in practice, and transformed nursing delivery systems in acute care settings. She has extensive implementation of quality improvement project in practice. Godrian Luthe earned his Bachelor's of Science in Nursing, has a master's in psychology, and is currently a registered nurse working at the Kibosho School of Nursing in Tanzania. Together, they worked in collaboration with Gladys Makawi, who is unfortunately able to join us today, but you will be able to hear her input throughout the course of the presentation. And now I would like to go ahead and turn our presentation over to Lisa Feller.
Sorry, just getting started here. Thank you very much, Stacy, for that introduction. And we are very excited today to share our collaboration and our work on our project, the Promotion of Global Health Competencies, the Moshi, Tanzania, South Dakota Rural Community Nursing Program. And we thought, what better way to start than to share this beautiful picture of Mount Kilimanjaro, which serves as a background for the home of our colleagues at the Kibosho School of Nursing. We also, as we get started today, really want to extend a very sincere thank you to the Matson Halverson Christensen Hamilton Foundation and the Global Rural Nursing Exchange Network for their very generous support of this project and their work in promoting rural healthcare across the globe. We're very grateful for their support of this work and the attention they are bringing to the importance of rural healthcare. As we proceed throughout our presentation today, we thought it would be interesting to share some of the comments and feedback from our students about how very meaningful this project was and how it is impacting their future practice as rural nurses. And this comment from Sydney Loken, who is one of the USD nursing student participants, I think really demonstrates that. And she shared that I've learned so much from this clinical experience with the students of Kibosho. The information we gathered and shared, along with the information that we received from the Kibosho students, will be very valuable as we continue on our path to taking care of our communities as nurses. And that's really what we were hoping for as we began this work. And I'll turn this over to my colleague, Godrian, and he can share some additional comments.
Thank you, Dr. Lisa. And for our sides, I think one of our students provided the feedback about how useful the project was. And from the feedback that was given by Sinfro Sangaida, one of our students, she said that having virtual meeting with the international students is our first great experience. Shared information has been useful, memorable, and relevant in our career. I am honored to be the part of this project, and I have learned so much from the South Dakota students. So that was the comment from one of our students.
The partnering universities in our project, as we've said, included the Kibosho School of Nursing in Moshi, and then the University of South Dakota. And this slide just shares a couple pictures of where those locations are. Our team was a fabulous team. And we truly enjoyed getting to know our colleagues at the Kibosho School of Nursing and learned so much from them as we proceeded throughout this project. And the Kibosho team included Mr. Gadrian Lute, who's co-presenting with us today. Madam Gladys McCawy, who is also one of the ambassadors for the GRNEN project. And then Madam Devota Sheo and Madam Liliosa Mamasi. All of us worked together as we continued to develop our strategies, along with Dr. Ann Pithen and myself from the University of South Dakota. A little bit about the background and how we developed our project. As we began to plan for our grant application and what our project might look like, we considered a lot of things that were influencing rural healthcare and global healthcare as we developed our plan. And one of those was the need established by the World Health Organization for competencies in global healthcare. And while developing those competencies themselves was beyond the scope of this particular project, we wanted to emphasize the importance of them and the importance raising the awareness of students developing them throughout their career. So that was one of the threads that we integrated within our project. Another was the identification of the need to promote healthy aging across the world, as we wanted to find a common area of focus for our assessments and our interventions. That really emerged as one of the leading needs. And so it became our initial area of focus with our collaboration. And then also the use of collaborative technology and the importance of developing exchanges in promoting competencies and cultural awareness. So those were some of the things that really served as the foundation for the development of our plan. This slide depicts again the two regions that were involved, and both areas are very rural in nature. The area around Moshi in rural Tanzania includes several community villages where the students from Kibosho completed their assessment. And then South Dakota is also a very rural area, highly agriculturally based. And that is where our students completed their assessment of the elderly population. And now I'll turn it over to Anne, who will share our goals and objectives.
Great, thank you, Lisa. So this project really had two main goals. And our first goal was to promote international cooperative learning and awareness of the global health competencies through the use of technology. And underneath this goal, we really had 5 areas that we wanted to kind of enhance from this goal. And Lisa and Gadrian have spoken of the first one about using technology to facilitate this communication. And so it was quite amazing that both in very rural areas that we were really able to connect and work on this project through technology. The second goal was so very obvious that we met this and did a great job with a great team of people. And that was to really have mutual, respectful, and collaborative relationships as we began and throughout this project. The third one is really what Lisa spoke about, is really that awareness for both students, all students, to have that awareness of those global health competencies. And as we get farther in the presentation, we really selected one of those global health competencies that we really worked from. The fourth one is we had an opportunity to compare and contrast priorities affecting health and well-being. And then lastly, we analyzed the impact of culture with both Kibosho and USD students on the delivery of healthcare. And then our second goal was to identify the health needs of the elderly population in these rural areas, and also to really identify and address gaps in care. As you saw the pictures on the previous slide, Both of these are very rural communities, and the students in South Dakota is quite a homogeneous population where we really had an opportunity to explore diversity, as in rural South Dakota, we may not always experience that. So from this goal, we really wanted to describe and learn from the roles of the healthcare providers, family and support systems in both communities, perform health assessment on our population, our rural elderly population, and really discuss and have an opportunity to learn about those barriers of healthcare in these rural settings. We also identified the health needs of the rural populations and looked at the similarities and the differences. And then lastly, to really compare and contrast the leading causes of morbidity, mortality, and barriers to care among our elderly residents. So as we had this very generous grant funding, we just wanted to say how this was used. So the Kibosho students, they use this for student transportation, accommodations, supervisor reimbursement, and equipment. And the University of South Dakota, we really use this grant funding to offer a college credit that will transfer over for them in the fall in their population health course. This next slide is just a picture of our fantastic students that, again, were so collaborative, so respectful, and we learned so much from each other. So on your left, that's the Kibosho School of Nursing students that participated. And on our right, this is the USD students that participated in this project.
Now I'll talk a little bit about the methodology that we put together. Once our grant was funded, we spent a significant amount of time between August and March of 2022 to establish our relationship, further develop that, formalize our methodology, talk about what would happen during the community assessment, the post meetings, etc. And one of the challenges that we really faced and overcame during that period of time was the alignment of our academic schedules. And that was something that took a little bit of time and work on the part of both schools to overcome and identify a period where students could meet and could also complete their assessments. And we identified that period of time as being the months of April and May. So that's when the majority of our grant work took place. Our grant really consisted then of a pre-fieldwork student meeting, which Gadrian will talk about a little bit more here in a second about what we accomplished during that. And then that was followed by the assessment, the community assessment, and clinical immersion. And then we held 3 post-fieldwork meetings, which were so rich and wonderful. And we'll talk about those in a little bit more depth as we go along here. But they really involved the sharing of our results and then the debriefing and learning that took place following that. So I will turn it over now to Gadrian, who can talk a little bit more about what occurred during that pre-immersion meeting and the community assessment. So Gadrian, I think you're on mute there.
Okay, thank you. Sorry for that. I didn't notice that. So as how Dr. Lisa said, we first worked on how to harmonize the 2 assessment tools that we were having. Mind you that the students from South Dakota, they are having their own tools that they are using to collect data and information in their community. And also we are having the guideline that is leading our students to collect the data. So the first step that we did, at least we were trying to see how we can harmonize the two instruments to make sure that the kind of information that both students they are going to share, they are at least similar, or maybe something that they can bring all together, or they can have the common consensus about what they assessed. So to create the tool, we identified some areas that we thought they are very important and they can match the two counterparts. And from that assessment, we come up with maybe the students to assess the transportation, the health facility, the elderly population that they are in their respective communities, and also recreational areas, and to see how the economic activity that they are available in two different parts. So from by identifying those areas, we managed to come up with a tool that we used it so that we can for our students to practice. And I think the tool was having three parts. The first part was about like scale, that's having the questions where the students were supposed to rate how they see the program. I think that part was having 5 questions. And from those 5 questions, the students were able to evaluate about the whole project and how they think the project works, about the technology and the other issues that were identified in that part. But also we were able to, from the tool, we were able the students were able to evaluate about the cultural perspective in different settings that they were practicing. So if we have to go through the first, for example, and the second, we cannot be able to share it from here, but if from the ratings, from the general ratings, those students go the scale, the Likert scale, we are having the scale from 1 to 3. So mostly the students, they rated the project as 3.7, I mean from 2.7 to 3. So you can see how those ratings, they show how they appreciate the project, how it was, and how they see the real project was conducted. For us to come up with that, also with the assessment tool, we had some virtual meetings, almost 3. We were having the pre-immersion, 3 pre-immersion meetings and 3 post-immersion meetings. From those 3 meetings, the students were sharing. The first was to connect the students first, to know each other so that they can know who they are interacting. And then the second meeting was all about, the first meeting was for South Dakota students to share what they found from the community. And the third meeting was for the nursing students to share. And the last meeting was to harmonize the 2 groups about what their take about the whole project and everything. So the previous slides that Lisa was showing was the slides that one of our cohort was interacting with the Tencel leader. We have the so-called Tencel leader in our community, the leader that supervise or make surveillance about for about 10 households. So they were trying to correct data and working around the community to correct. And from this picture here, as how you can see, because our environments is quite different from the South Dakota, but from this picture you can see that at least we are having the tropical kind of climate. So from this tropical, we can do a lot. We are normally involved into agriculture. The majority in our community, they engage into agricultural activities. Students were able to share about the economic, but together from their assessment, because we were also trying to we were also trying to assess about the population, the number of elderly in different communities. So in average, we saw from the presentation that the student they presented that if you have to compare the two communities, it's like in Kibosho, we have a lot of younger generation. We have a lot of people who are adolescents and young adults compared to South Dakota. So in general, we did a lot, but I think in a nutshell, that's what we can, at least we can give as a highlight from this.
Thank you, Gadrian. So I'll now share a little bit about what occurred in our post-immersion meetings. And though, as Gadrian said, we held 3 post-immersion meetings. During the first meeting, the University of South Dakota students presented the results of their assessment to the Kibosho students and identified what the priority health needs were of that, the elderly population in their area. And in South Dakota, they identified priority needs related to physical activity, safety, social isolation. And then priority interventions included education, environmental assessment and modification, and access to the available programming in that particular community. And the students in both schools used evidence to support their findings. For example, the USD used evidence and also the Healthy People 2030 resources to identify priority interventions. So each of the meetings included time for students to have question and answer. For example, often we discuss leading causes of morbidity and mortality, financing of healthcare, lots of things around those areas during the meeting time. The second meeting then allowed the Kibosho students to present their findings to the South Dakota students. And the priority needs that were identified during that meeting included knowledge deficit, problems that related to low economic status, and problems that related to hygienic needs. So priority interventions included education and resources regarding family planning, and also sanitation. The third meeting, I have to say, was probably the most powerful and meaningful meeting of our whole entire project. And this was the opportunity for the students to really engage in mutual learning about the similarities and differences between the healthcare delivery systems and needs and the impact of culture between the two countries. And it was so amazing to watch the students be very engaged with each other, ask each other questions, and really learn from each other about the delivery of healthcare. And one example that I'll share of a very meaningful moment was for the South Dakota students to listen to the Kibosho students talk about how they use traditional healthcare practices to enhance the health needs. And they didn't try to change the traditional healthcare practices. They worked with them and enhanced them to try to improve the quality of healthcare and the delivery of healthcare. And I think that was a very interesting moment for the South Dakota students, and is kind of demonstrated by this quote from Haley Michaels, one of the students, about that the grant allowed her to gain a better understanding of global health and the importance it holds in her career. And it also helped her learn more about how much cultural practices actually impact nursing care and how we can navigate those situations. So I think that really highlights how impactful those joint discussions were for the students. So I'll then turn it over to Anne to share a little bit more about detail about the learning that occurred.
Thank you, Lisa. So our next few slides, we would just like to give you kind of some insight into how these meetings went. And as Lisa and Godrian have stated, the rich discussion and awareness of each culture. And as we look back on, one of our goals is really to increase awareness of global health competencies. And one of those that we really focused on was that ability to understand cultures, to collaborate, to demonstrate respect, and awareness and openness to other cultures. So I believe as we look at these next slides, you'll see that come through very, very strongly on that global health competency. So the first question that we really talked about at our third meeting was, what did you learn about nursing in each country? And so as we looked at the USD response, they really learned and took away from the Kibosho students the importance of education and how important that is to develop the knowledge, skills, and attitudes necessary for nursing. The Kibosho student response is that they gave us some insight into nursing education and that fewer nurses obtain a BSN in Tanzania, but they really have an opportunity to work in diploma programs, and they get so much practical immersion into the nursing profession as students. And then lastly, just some additional comments. It was so exciting and interesting to see that both groups of students really, the similarity was how much the bonding of these nursing professions was to care for patients and communities. And one thing again that we learned is that the Kibosho students spend more time immersed in the community. And where in the US, we've kind of moved away from those diploma programs, which were 3-year hospital-based nursing programs. Next slide, Stacy. So what did you learn about the delivery of healthcare in each country? And that it was interesting, the USD students really gleaned from this that we have a lack of resources in both countries. The healthcare delivery in the US is more formal and sometimes more complicated. Prevention is a focus in the US, as it is in Kibosho, but we still have some work to do here, was kind of an insight that came from that. And again, the importance of the nurse in prevention in both countries came out loud and clear through our discussion. The Kibosho student response, we learned so much from them about how the primary, secondary, and tertiary care is provided. And their care delivery system is more decentralized than it is in the US. Again, we talked about just the lack of resources that really can impact healthcare. And that what we learned is that both countries have special programs related to the elderly. So in the US, as we know, we have Medicare and Medicaid, but also in Tanzania, they have special programs that really support elderly and elder care. The next slide is, what did you learn about similarities and differences in cultural influences on healthcare? And we loved this question because as the world has become bigger but yet smaller, we see so much diversity and cultural care in both countries. And from the USD students, they learned that the Kibosho, they're much more open to sharing information, where sometimes in the US, people can tend to be much more private. The other thing that we learned is that nutrition is so impactful in both countries. And in the US, fast food is accessible and often leads to obesity. And so that can really be, even though it's easy access, I guess, for all of us, it can really create some nutritional impacts in the US. And then the other thing that was so interesting is that in the US, we focus on individuality. And we've made a shift from a multi-generational to a single family focus over many generations, which is different than what we see in Kibosho. So in Kibosho, there's such a strong influence on nutrition. And so they really do a lot of education on nutrition. It was so interesting. So as fast food in the US, in Kibosho, they essentially cook all of their own food. And so even though they have access to fast food, obesity in Kibosho is seen really as an indicator of wealth. Kibosho relies on herbs for medication and medicine, and they do a lot of education on the appropriate use of herbs in that country. And then lastly, they circumcise women to prevent sexual behavior. The next question is, what did you learn about the importance of developing global health competencies? And again, such interesting responses. The world is becoming more global, and it's important to learn and to be aware of other cultures. And again, I think we really did a nice job with this global competency. US nurses are taught to deliver fair and impartial care to all. But also that cost and access are prohibitive. They continue to be in rural nursing and in healthcare across the US. And again, it's so important to kind of leave our biases at the door and to really treat all people with respect. The Kibosho student response was they gave us so much insight into the role of the nurse in Kibosho is to create awareness, educate, and increase knowledge. They really work to increase that interaction between healthcare providers and the patients. And I loved this. They were very clear on they respect and embrace tradition rather than eliminate practices. And again, as stated on that previous slide, they really work to increase that knowledge on using herbs in their tradition and culture to really create safe practices and positive outcomes for patients. And then what did you learn about similarities and differences? And this really, I think, again, brought this global awareness and health competencies to the forefront. So in the US, we focus on safety and prevention of the vulnerable populations. And they talked a lot about vaccinations and seat belts and car seats in keeping our population safe. They focused on education and wellness for all vulnerable populations. And again, we talked about that leading cause of death is chronic disease, heart disease, and cancer. And as we looked at our Kibosho student response, again, the similarities is their leading cause of death is heart disease. Their average lifespan is lower, and that is due to lifestyle behaviors. Access to elderly is difficult due to transportation and lack of technology. And the elderly use traditional medicine. And then what was interesting as well is they have a higher mortality rate in children under 5 years of age. So we learned so much about what we both do well, what we both have areas to improve on, and really the similarities that draw us together. Next slide, Stacy. Oh, and this one, so fascinating. What is the perception of caring for the elderly in each country? And I loved this. This brought so much awareness to all of us. Again, from the USD, we have a shift in our country from family members caring for family members. We talked a little bit about, assisted living and nursing homes that can support that level of care for our elderly. Access to care may be more challenging due to extra insurance requirements for Medicare. And again, what was really came through here is that the care for the elderly is not prioritized. Instead, it is based on acuity of the patient care. And again, I loved this from our Kibosho colleagues. Care for elderly is prioritized. That is really a population that they work hard to make sure that that care is at the top of priority. The elderly are valued and viewed with wisdom and respect in this country. And the policies that are generated from Kibosho is they promote emphasis on treatment of the elderly, and they need to be treated first. So again, I hope you had a glimpse into this awareness, this cultural humility, this global competencies that we really worked hard in this project to demonstrate. And so this was our project outcomes, and Gadrian spoke a little bit about this earlier. So we had a score of 0 to 4 here, with 0 meaning not at all, and 4 being very much. And so these were our 5 things that from this project we looked at. Increase the understanding of the role of culture in shaping healthcare beliefs and practices. And you can see that these scores were high from with a combined group of 3.46. The second one is to increase understanding regarding healthcare needs of the elderly populations in each country. Again, you can see that our combined groups here with an N of 13 is 3.62, with 4 being very much. Number 3 is to increase understanding of the barriers in healthcare in each country. Again, with that combined group score of a 3.62. Increase understanding of similarities and differences in nursing practice in each country, which was a 3.77, which was really our highest score here. And then number 5 was the extent that technology facilitated communication and collaboration between students in each country. And that with a combined score of 3.31. And so again, looking at those project outcomes and those goals, we are so appreciative of this grant, and we feel that we really met those on a very high level for us. And then lessons learned. I love this slide, and I think this really ties it together for us. So the passion of nursing and the desire to improve health for the community was a universal passion that was felt through technology, through the screen, that we both very much share that. And that was just endearing and exciting to see for our profession. We also have some very similar challenges that I think we can continue to work toward to overcome in our cultures. And what we learned is that technology, even though it has some challenges, it can be successfully used to develop relationships and bridge learning across the world. And then lastly, we learned so strongly that it is important to demonstrate cultural awareness, acceptance, and respect toward all cultures to provide quality healthcare. And then our future opportunities, I'm just glancing here to make sure I'm not taking someone's spot here, is to build on relationships between the programs. This relationship building was just fantastic. And as Lisa and Gadrian have said, we worked with a great group of people. To enhance the understanding of the importance of global and cultural competencies. So we spoke of that one that we really feel like we met so well, but there's other competencies that we would love to bridge within this profession. The next future opportunity is we would love to continue to address priority health needs in rural areas. And lastly, we want to continue to incorporate that interprofessional communication and collaboration, which is so important to the success of the nursing profession throughout the world.
And I'll just wrap up here with our contact information. Our email addresses are included. We would certainly welcome any questions or inquiries regarding our project at any time. So feel free to contact us if you have any comments or questions. And we'd certainly love to take some questions now.
Well, thank you so much. That was an incredible presentation, and I'm so happy to have had the opportunity to be a part of it. We are going to have some time now for any questions. Please feel free to either use the chat feature or the Q&A in your Zoom panel, and we will monitor that and be able to ask our panelists that on your behalf. Also, just as everyone's thinking about what they want to say, I want to take a quick moment and piggyback off of something that was shared in the last slide about how the call to technology can successfully develop relationships. That's something that's critically important to GRNEN. And one of the biggest foundations of the GRNEN organization was to create an online platform to unite rural nurses, rural nursing students, educators, researchers, and anyone with a passion for rural nursing and rural healthcare. We've done that by creating this robust online community that is actually free for anyone in the industry to join, where you can connect with others worldwide, ask questions, collaborate, commiserate, and really just get a feel for what everyone's doing around the world. So we encourage you to join that and to be able to develop relationships that way. So we do have some questions coming through. One is, are there plans to do a student exchange between nursing schools in the future? And I believe that might be something, Corey, I wonder if that, or Lisa, as leadership, is that something maybe perhaps you can address? Because I know GRNEN initially started with that as the brainchild for the organization. Again, are there plans to do a student exchange between nursing schools in the future?
Yeah, that would be awesome, wouldn't it? That actually was one of the original plans prior to the pandemic. So, and that would be awesome. So, it's certainly not something that we're ruling out. Where there's no specific plan at this point in time, but that would certainly be great.
What would you do differently if you were planning the work of this grant with what you know now?
I can take that one, or start anyway. I think as I said earlier, one of the biggest challenges really was aligning our academic calendar. So I think that given a longer time frame, that would help give us both more flexibility to do that, and then also possibly allow us to include more students in the experience. And it would be really nice, I think, to be able to expand this wonderful opportunity to a larger group of students.
So we've been asked, now that you have gone through the process, what would your dream collaboration be?
I can maybe take this question. I think a dream collaboration is I really just what I think the students learned so much from was just understanding people, understanding that within their practice, whether it's rural or urban, they are going to really be reaching people with different backgrounds, different beliefs, different cultures. And I think a dream collaboration is really just to expand on that, where we can really see how this is taken into practice, and just really growing these global competencies. I think that this is becoming so important in our world, so that nursing care across all countries is just really open and really excellent care. So my dream collaboration is just to continue to grow these global competencies so that our nurses out in practice can continue to live them and really understand what that means.
Any other questions? I have something popping up here. Which area should we focus on in the future to increase competencies?
I can take that too. And Godrine, you may have a different idea about this too, but the World Health Organization has identified several different global health competencies. And, a lot of them, again, related to respect, but also teamwork and collaboration. So I think that beyond understanding and respecting different cultures, how you can actually use that to collaborate and to work as global teams to improve health outcomes of all populations. So I think it just sort of takes that to the next level. Technology is actually another competency that's included in there. And I think that's a beautiful piece of this particular grant project, is beginning to explore various uses of technology to enhance global collaboration and cooperation. So I think those are a couple in particular, but there are certainly many others that relate to leadership and other aspects of the delivery of healthcare. So there's a lot of work to be done in that particular area.
Okay. Well, if there aren't any other questions, I just want to share one final screen. Sorry, bear with me. So while we said before that the community with GRNEN is open to anyone who would like to participate, and I know that Lisa had shared the contact information for Gadrian and herself on her previous slide. If you didn't capture that, we can always send that to you. However, you may also feel free to connect with any of them directly through the GRNEN community. The web address is on the screen now, community.grnen. If you don't have an account, it's very simple to create one, and you can locate any of them in the member directory, message them directly, and start conversations. As a quick reminder, we have our fourth presentation tomorrow morning at 9 a.m. Central Time in our grant series. That one is going to be focused on In Touch, International Nursing Technological Outreach, Uniting for Community Health, presented by collaborative groups from the University of South Carolina, Greensboro, and the Matibabu Foundation College of Health and Sciences in Kenya. We expect this to be another really insightful opportunity to get some learning exposure for this collaboration group, and welcome you to join, as well as this one that will be recorded if your schedule does not permit. So thank you again to our presenters. Thank you again, Corey and the MHCH Foundation. Please, if you are interested, if you have student groups that are interested in having this opportunity to explore a collaboration, the grant program is open until August 1st of this year. Announcements will follow the week after, and the programs will run from September 1, 2020 until December 2023. So we hope that you enjoyed the presentation today. We will make the recording available by the end of the week. And if you have any additional questions, please feel free to reach out and let us know. Thank you so much for joining us. Take care now.